What if your liver is getting damaged, but you feel completely normal? That is the scary part about fatty liver disease. Many people do not feel pain. They do not feel sick. And in many cases, they do not know anything is wrong until the liver has already started developing scar tissue. In part 1, we talked about how a healthy liver works and what happens when fat begins to build up inside the liver. Today, in part 2, we are going one step deeper. We are talking about liver fibrosis, and how a test called FibroScan may help detect liver damage earlier. Fatty liver disease is often called a silent condition because it may cause few or no symptoms, especially in the early stages. Some people may feel tired or may have discomfort in the upper right side of the abdomen, but many people do not notice anything at all. So, what exactly happens inside the liver? When extra fat builds up in the liver, it can sometimes lead to inflammation. If that inflammation continues over time, the liver tries to repair itself. But during that repair process, scar tissue can begin to form. That scar tissue is called fibrosis. Fibrosis is important because it tells us that the liver has moved beyond simple fat buildup. It means the liver has started showing signs of injury. Now, here is the key point. Fibrosis can develop quietly. A person may still look healthy. Their daily routine may feel normal. But inside the liver, scarring may slowly be building up. That is why early screening and proper medical evaluation matter, especially for people who have risk factors such as obesity, type 2 diabetes, high cholesterol, metabolic syndrome, or abnormal liver blood tests. NIDDK notes that obesity, metabolic syndrome, and type 2 diabetes can increase the likelihood of fatty liver disease. This is where FibroScan becomes important. FibroScan is a non-invasive test used to assess liver health. It does not require surgery. It does not involve a needle. It uses painless vibrations to measure liver stiffness, which can help identify scar tissue buildup, also known as fibrosis. Cleveland Clinic describes elastography, also known as FibroScan, as a painless test that can show whether the liver is stiff from scar tissue buildup. A healthy liver is usually soft and flexible, but when scar tissue builds up, the liver can become stiffer. FibroScan helps measure that stiffness. It can also help evaluate fat content in the liver using a measurement known as CAP score. Cleveland Clinic notes that FibroScan can provide two important measurements: liver stiffness for fibrosis and CAP score for fat content. This makes FibroScan useful because it gives doctors more information about what may be happening inside the liver, without immediately needing more invasive testing. But remember, FibroScan is not something people should use to diagnose themselves. Results should always be reviewed by a qualified healthcare provider. Your liver may stay silent, but liver damage does not always stay still. Fatty liver can progress to fibrosis, and fibrosis can become more serious if ignored. In part 3, we will talk about the stage we want to prevent, liver cirrhosis. Stay connected with CTN for more health education and clinical research awareness.